Welcome to the platform of Just Nursing Things. So, we are currently doing with GI disorders, and part 1, 2, 3, and 4 have already been uploaded, and we have so far doing with INC syllabus के according हम लोग कर रहे हैं, and we are completed till hemorrhoids, fissures, and fistulas. So now we are starting with pancreas. So let's start with pancreatitis. So pancreatitis, it is an inflammation of pancreas. If you want all these upper topics to be clearly explained, so do visit that part also for better understanding. So we were on pancreatitis. So pancreatitis is the inflammation of the pancreas. It is a gland, the gland that is located behind the stomach and that produce digestive enzyme like and hormones like insulin and glucagon. So pancreatitis, जब pancreas में inflammation हो जाए, that condition is known as pancreatitis. So we are having types of there are two types of pancreatitis, that is acute pancreatitis and chronic pancreatitis. Acute, we are having sudden inflammation. Acute, as the name suggests, is a short duration and it is usually reversible. And chronic, it is a long term inflammation, progressive and irreversible damage is there. What are the etiology, or we can say causes? So gallstones can be the most common cause of pancreatitis. Alcohol abuse, abdominal trauma can be the infection, can be there. Hyperlipidemia also leads to pancreatitis. Hypercalcemia can also lead to certain drugs. ERCP procedure can also cause pancreatitis. So what are the causes of chronic pancreatitis? Like chronic alcoholism, मतलब बहुत टाइम से अल्कोहल का कंजप्शन कर रहा हो. रीकरेंट एक्यूट पेनक्रियाटिस, वहाँ पर एक्यूट पेनक्रियाटिस हो जा रही है जिसकी वजह से क्रोनिक पेनक्रियाटिस डेवलपमेंट इज देयर. Periodic conditions like smoking, genetic disorder, and pancreatic duct obstruction. Pathophysiology, we are having pancreatic enzymes like trypsin, lipase, amylase are activated inside the pancreas, and enzyme begin to digest pancreatic tissue. enzyme खुद के टिश्यू, अपने ही pancreatic tissue को digest करने लगते हैं, जिसके वजह से inflammation, edema, hemorrhage and necrosis develop हो जाता है. And in severe cases, enzyme enter the bloodstream and cause systemic complication. In chronic pancreatitis, there is repeated inflammation that is leading to fibrosis. Loss of endocrine and exocrine function is there. What are the signs and symptoms, or we can say clinical manifestations? So acute pancreatitis में we are having severe upper abdominal pain that is radiating to back, pain worsen, खाना खाने के बाद पेन और वर्स हो जाता है. Feeling of nausea and vomiting, fever is there, abdominal tenderness and guarding is there, tachycardia is there, hypotension is there. Cullen sign is very important. Pancreatitis में grey Turner sign and Cullen sign is there. So Cullen sign क्या होता है? Bluish discoloration around the umbilicus region होता है, and grey Turner से एक flank bruising होती है. Let me show you the image for better understanding. So this is the Cullen sign, bluish and swelling around the belly button. Chronic pancreatitis, recurrent abdominal pain is there. There is fatty stools is present. Weight loss is there. Diabetes mellitus condition. Now how we will detect diagnostic evaluation? And we will see serum amylase level will be increased, serum lipase level will be also increased, blood glucose will be also increased, serum calcium level will be decreased, and serum triglycerides level is also increased. CBC, we will check for leukocytosis. Imaginary study में will see ultrasound for gallstone, CT scan in severity and complication, MRI is done. Medical management में what is acute pancreatitis में we have to keep the patient nothing nil per oral. IV fluid to prevent dehydration will be IV fluid will be given. Pain management will be given, like we will give some opioids. Antiemetics for prevention of vomiting. Proton pump inhibitor will be given. Antibiotics are given. Nasogastric suction is done if vomiting is present. And in chronic pancreatitis, pancreatic enzyme supplements, insulin or oral hypoglycemics, low fat diet. So now let's see surgical management. कोलोलिस्टोमी, अगर गॉल ब्लैडर गॉल स्टोन की वजह से पेनक्रियाटिस है तो हम लोग सर्जरी करेंगे कोलोलिस्टोमी. Pancreatic drainage procedure can be done. Resection of damaged pancreas means we can cut off the damaged part of the pancreas. Pseudocytes drainage can be done. Whipple procedure in severe cases it is done. सो विपल प्रोसीजर में मेनली ये ट्यूमर और कैंसर को रिमूव करने की सर्जरी होती है. इसमें मेनली हेड ऑफ द पेनक्रियास को रिमूव कर दिया जाता है. एंड नर्सिंग मैनेजमेंट, वी विल सी फॉर द पेन मैनेजमेंट वी हैव टू असेस पेन रेगुलरली. And analgesic is common, we have to administer it. Position will be provided is knee, chest position or side like position. Fluid and electrolyte balance, we have to monitor intake and output, observe for sign of dehydration, and monitor, we have to monitor electrolyte. Nutrition care में that's so obvious that नील पर oral initially रखेंगे. Start enteral feeding when tolerated and provide a small frequent low fat meals. Why low fat meals? Because pancreas की condition altered है, it won't be digested properly. Vital signs should be maintained, blood glucose level should be checked, and sign of infection should be checked. Abdominal assessment. Now we are having patient education. We have to avoid alcohol and smoking. We have to tell patient don't, means to quit it. Diet modification will be there, means that only fat diet should be avoided. Medication adherence should be strict. Nursing में acute pain related to pancreatic inflammation, imbalanced nutrition, less than body requirement, risk for fluid volume deficit, there will be risk for infection, impaired glucose regulation. What are the complications? Local complications we are having pancreatic necrosis, pancreatic pseudocysts, abscesses will be there. Hemorrhage will be there, shock condition can be there, acute respiratory distress syndrome can be there, renal failure, sepsis, septic meningitis, and malabsorption syndrome can be there. And now we are having pancreatic cyst. That's our second topic of according to our INC syllabus. So pancreatic cyst. A pancreas is a condition in which fluid filled sac that develop inside or in the pancreas में fluid fill हो जाता है mainly sacs के form में. It can be benign, या तो non cancer or malignant. It can be cancerous and can be true cyst or false cyst. So types of pancreatic cyst we are having pancreatic pseudocysts that are most common, lack epithelial lining, developed after acute or chronic pancreatitis, contains pancreatic enzyme, blood and necrotic tissue. True pancreatic cyst में we are having an epithelial lining. There can be congenital cyst that is present since birth. It is a rare and often associated with polycystic disease. We are having retention cyst due to obstruction of pancreatic duct, which is a retention cyst can be also there. Neoplastic will be the tumor lattice cyst like serous cytosodoma that can be benign, mucinous cystodenoma that can be pre-malignant. And let's see the causes of pancreatic cyst. So acute pancreatitis can be the cause, chronic pancreatitis, pancreatic trauma, alcohol abuse, gallstone, congenital abnormality, pancreatic tumors, and duct obstruction. Pathophysiology, we are having pancreatic duct injury or inflammation can be there, leakage of the pancreatic enzymes digesting surrounding tissue. See, pancreatic duct में inflammation जाती है जिसकी वजह से लीकेज होने लगता है pancreatic enzymes का, because of enzyme digest surrounding tissue and enzyme start to digest करने लगता है surrounding tissue में. Fluid collect हो जाता है near the pancreas and in pseudocyst there will be no epithelial lining will be seen, wall formed हो जाएगा fibrous tissue का because tissue will start to resist the damage and in their condition fibrous will be developed. Cyst may increase in size and causing pressure on nearby organ. So that was our pathophysiology. Now we are having clinical manifestation. Let's just see the sign and system. Mainly asymptomatic रहता है patient. He in initial stage he don't have any kind of sign and symptoms, and you can see some symptomatic symptoms like upper abdominal pain will be there, fullness or masses in the abdomen, nausea and vomiting, weight loss can be seen there, jaundice condition, fever and abdominal distension. Diagnostics, the evolution is same as that of pancreatitis, that serum amylase level will be increased, serum lipase level will be increased, liver function test for if biliary obstruction is there, blood, we have to check for blood glucose level, imaging studies we have to do, fluid cyst analysis, and medical management में it is same like that of pancreatitis. Surgical management, we have to see indication for surgery, large cyst है, persistent cyst है या symptomatic है, and like that the surgery will be there, like endoscopic drainage can be there, percutaneous drainage can be done. So these are the surgery common that is done in pancreatitis. In nursing management, we are having, we have to assess for the abdominal pain, vital sign, infection and abdominal growth. We have to manage pain management and positioning of the comfort. Nutrition will providing small frequent meals, low fat diet, enteral or perienteral nutrition if needed. Fluid and electrolyte balance, we have to monitor intake and output and maintain IV fluids, and patient education education about avoid alcohol, follow up imaging, medication complications, and nursing diagnosis will same as that of pancreatitis. So अगर आप pancreatitis को we will go through, तो उसके सारे भी जो conditions हैं, so that will be having same. Complication में we will see it is same as that of something is just change like infection and abscesses, hemorrhage, rupture of cyst, obstruction of bile duct, or pancreatic fistula can be there, sepsis can be there. Now we are having proceeding with pancreatic tumor. So pancreatic tumor एक abnormal growth होता है cells in the pancreas. It is same that can be benign or malignant. Malignant tumor of the pancreas highly aggressive and have poor prognosis. Types of pancreatic tumor, so benign pancreatic tumor and malignant. Etiology, we can say causes like cigarette smoking, chronic pancreatitis, diabetes mellitus, high fat diet, alcohol abuse, obesity, genetic mutation can be there, family history of pancreatic cancer and exposure to chemical. And pathophysiology में genetic mutation can cause abnormal cell growth. genetic mutation की वजह से सेल का abnormal growth होने लगता है, जिसकी वजह से tumor develop in pancreatic duct और gland cell. Tumor block the pancreatic and bile duct, जिसकी वजह से digestive enzyme and bile का flow decrease हो जाता है, जो कि lead करता है malabsorption and jaundice को. And tumor spread to nearby organs like lymph nodes, liver and lungs. Metastasis is there in pancreatic tumors. Clinical manifestation, the general symptoms will see dull or severe abdominal pain radiating to back, unexplained weight loss will be there, loss of appetite will be there, fatigue, बहुत ज़्यादा थकान महसूस होगी, weakness. And if the tumor अगर head का हो तो dark urine can be seen, pale stone, peripheral itching can be, a lot of itching is seen in pancreatitis, painless progressive jaundice. Endocrine tumors में we will see that hypoglycemic condition होगा, peptic ulcer, gastrinoma, diabetic mellitus can be there. In laboratory test we are having increased LFT, serum bilirubin level will be increased, blood glucose level will be increased, tumor marker CA 999 will be increased, CE will be there. Imaging studies में will see ultrasound, MRI, endoscopy for seeing the structure of the pancreas. Biopsy is done for fine needle aspiration to confirm the which kind of cancer it is and which stage it is have been gone. Medical management we are having chemotherapy, radiation therapy, pain management, pancreatic enzyme replacement, nutrition support, insulin, antidiabetic drug. Surgical management we are having localized tumor will be there. सेकंड लगा विपल प्रोसीजर ऐसे इसमें हेड ऑफ द पैनक्रियाज में मेनली कैंसर रहता है, उसको हेड को रिमूव कर दिया जाता है. डिजिटल पेनक्रेक्टोमी, टोटल पेनक्रेक्टोमी कैन बी डन. नर्सिंग मैनेजमेंट वी हैव टू हैव रेगुलर पेन असेसमेंट विल बी देयर. न्यूट्रिशन वी हैव टू प्रोवाइड हाई कैलोरी हाई प्रोटीन डाइट, स्मॉल frequent meal we should be giving, monitoring of vital blood glucose, jaundice condition and weight monitoring will be there. Emotional support is very important. Pre and post operative care after the surgery. Nursing diagnosis, chronic pain related to tumor growth, imbalanced nutrition, less than body weight, anxiety related to diagnosis and prognosis, and impaired skin integrity as jaundice related is there, and risk of infection. Complication में we are having metastasis, obstructive jaundice, diabetes mellitus, malnutrition, ascites, bowel obstruction, depression and death. So we have so far completed with our pancreatitis condition. Now in next part we will continue with liver inflammation, that's liver, all the conditions of liver according to our INC syllabus. Till the time wait for our next lecture, and do like, share, subscribe the channel if you found the class helpful.